Okay. Hello, my name is Ari Chacko. I'm a senior consultant in neurosurgery at the Apollo Proton Cancer Center in Chennai, that's located in India. I give my consent to the Apollo Proton Information Center to use this video for whatever purposes they need to. Um, I would like to talk to you about brain tumors, which is a specialty that I deal with. Patients often wonder, how do we detect brain tumors early? And it's a question of being aware of any change in behavior, either over a few months or a few years, if it's someone who's related to you. Headaches that are not that are out of ordinary. If you've been having migraines 3, 4 times a month and they become more frequent or more intense, the character changes, then that's something that needs to be investigated. If you have incessant vomiting associated with the headaches or blurred vision, then these are indicators that it could be something serious. Loss of memory, which wasn't present earlier, weakness on one side of the body, weakness of the face, difficulty in hearing. So these are all features that should lead you to seek medical attention. And since CT scans and MRI scans are so freely available, I feel that imaging should be done quite early when patients or if you have these problems. Because one thing is very clear in neurosurgery, the outcome after surgery, that is, how do you recover after surgery? Will your vision improve? Will your weakness improve? Will your memory improve? These all depend on how badly you are affected before you are diagnosed. So if you're diagnosed late and you go to the hospital on a wheelchair or use crutches, then the chances of improvement are less. If your vision is very poor and you're completely blind or you can't see anything, and you have a brain tumor that's causing that problem, removal of the tumor will not result in much improvement. So if you detect tumors early, then the chances of recovery are very good. Most brain tumors are malignant, that is, they are cancerous, but there have been good advances in our technology in the treatment of these tumors. And so, if you detect some of these cancers early, it is possible to improve quality of life and probably even extend survival. Benign tumors, on the other hand, are completely curable, and patients can lead as normal a life as possible after surgery. There's another misconception that many people have about neurosurgery, and that is anybody who goes into the operation theater, there's a 50% chance that he won't come out alive, or he's going to have weakness on one side of the body or go blind. And that's not true. Right now, for elective neurosurgery, that is not an emergency, the mortality rate or the chance of death is 1% or less in a good center. So, the final take home message is that be aware and conscious of any new change that is occurring in you, whether it's headaches or vision or movement. Seek medical attention early, get an image done early, and don't be afraid of seeing a neurosurgeon. Thank you.